Hi there, and thank you for joining us on another episode of The Nation. Now, Cyberview Living Lab Accelerator empowers promising startups by providing a conducive platform for them to experiment, pilot, launch innovative solutions, and grow. The program provides entrepreneurs support in the areas of human capital, funding, mentorship, infrastructure, as well as market access. Joining me in the show today is Dr. Nick BODEN, CEO of KLEAN, as well as NURA SAMSUDDIN, co-founder of Supagene.Asia. And we'll be talking about promoting a culture of health through healthcare AI transformation. Welcome to the show, guys. How are you doing?
Hi, Sonia.
Hi.
Thanks for having us. Hi, Nora.
Okay.
Great. Now, in order to meet the requirements of, patients, healthcare artificial intelligence is becoming more prevalent and changing our lives in unexpected ways. Perhaps both of you, let's start with Dr. Nick. Share with us your company's background and what sparked the innovation that led to.
Thanks, Sonia. Well, KLEAN uses AI to recognize plastic containers. So our company started as a company that concentrated on changing people's behavior. So what we do is we have these smart reverse vending machines that incentivize people to put their plastic containers into them. And we give people 10 points for each container that is recycled. And they can swap those points for things like touch and go, theme park rides in Genting, Tesco vouchers, and grad points, bonus link points, etc. So we, coming out of a healthcare environment, I had a lab that was printing customized insoles for people's feet, and these 3D printers that we were using use plastic filament. We had an opportunity to help kids who were born without limbs or had a crash injury, and we 3D printed these hands. And to get them to pay for them, the idea was that they would need to collect a certain number of PET containers, so plastic drinking containers, whether it's water or cool drinks, are called PET containers, so that we would teach them the importance of sustainability and cleaning up the environment. And out of that, we got this idea of KLEAN, whereby it's this ecosystem, which includes the machines as well as the app, to basically change people's behavior and to create a more recycling behavior. And AI is an integral part of our system, where we recognize both the type of container and also the brand that's in there.
Interesting. So it's a platform that actually promotes recycling through behavioral change by incentivization. Now, for you, Nura, Supagene.Asia, I understand it's preventive genetic testing. Perhaps you can share a little bit about the product and the thing that sparked the innovation to Supagene.Asia.
Hi, yes, Sonia. I think before I can go further on my product, I would just like to tell you briefly how Supagene actually come about. We are actually working in the life science industry for the past 8 years. So we are working closely with all the researchers that are doing all this science at the back, with all the resource, expertise, and the connection that we have. This where the Supagene launched, where we in 2019, where we come up with a home-based genetic testing. So imagine now, if you want to do DNA testing, you don't need to go to hospital. You can just get the kit online from us, and you can just run everything at the comfort of your home. So what we do is that we are actually extracting a DNA from your saliva and run it into a microarray platform and extracting out the whole raw data of your DNA. So the AI part that our team is building is actually the transforming of the raw data of your DNA into a functional, personalized DNA report. So this personalized report is the thing that we are actually building up. From this report, you can get to know not only your risk of getting any diseases or cancer, but you can also know how your body functioning. So from all this report, you can achieve a prevention of your future diseases that you might have, and also going to personalize wellness and also healthcare towards your body needs based on your genetic information.
Great, very interesting. As they say, early detection saves lives. And also, I love how straightforward and simple the procedure is. No blood, no needles, just saliva, and you can get a full report on your DNA. Now, for KLEAN, Dr. Nick BODEN, tell us a bit about the value that it brings to the target market. I love your tagline of turning trash into cash. That's very catchy, I must say.
Yes. So the question is around the target market, right? Who are we targeting?
How are you targeting, and what are some of the values that it brings to the target market?
So I mean, we're targeting everyone, to be honest, and we've done various pilots throughout Malaysia in different settings, shopping centers, petrol stations, etc. And it's really encouraging to see that across the whole socioeconomic spectrum, there's a lot of stickiness around what we do because of the interactive nature of it. And we also have built what we believe is the world's first mobile reverse vending machine. I took my old Hyundai Starex I used to drop my kids off at school in, and we built two reverse vending machine slots into the back of it. So that's able to go to schools and go to events and really to capture people's imagination around the concept of recycling. So our target market is pretty much everyone, and we do cut across all the different socioeconomic sectors, and we've created a lot of excitement. We get a lot of data. So I think the real exciting area where we are at the moment, and it's the same thing with NURA's product, is NURA's collecting medical data. We're collecting data around recycling habits and what is being returned. So every single machine has really granular DNA around, how many recyclers have been created at that recycling machine, how many containers. We can even tell you the brand of container that's being put in there, as well as how much carbon is being saved. And that's really important information in this era of what we call ESG and extended producer responsibility legislation, which will come into Malaysia as part of the government's 2021 to 2030 plastic roadmap. So we're in a perfect situation, and we've proven the model and shown that Malaysians, they love the system. We've given away 90% of the points that we've made available. So there's a lot of stickiness with what we're doing. And we also have a 30 machine rollout happening in the Klang Valley, which launches on Earth Day on April 22nd. And that's sponsored by DHL. So we're super proud to be working with a Fortune 500 company who've recognized the value of what KLEAN is doing, both here in Malaysia and potentially elsewhere.
Interesting. It's a very interesting twist that you bring, to recycling and encouraging their recycling habits amongst us, compared to the conventional bins that we see around. Now, for you, NURA, what are some of the current markets that you're are we talking about the younger generation or the older? Because I'm sure DNA testing is something new and unheard of for many of us. Perhaps you can share more about the target market and the value that it brings to them.
Yeah, Sonia, for us, because we are doing like a wellness DNA testing, our market is really divided into two. One is like direct to consumer, which is B2C, and now the one is B2B market, business to business. For direct to consumer, we are looking for someone that just wanted to know their DNA testing and wanted to have consultations. So it's like very direct. Mostly this target market is for like a young people that have a proactive action towards their health. And then for B2B market, we are actually looking for some businesses that can utilize our reports and then couple with their services and also product and give solution based on their client as a whole personalized package. So currently we are working with wellness centers, fitness centers, nutrition centers, and even medical centers like hospitals and medical center to use our DNA testing as a service provider and couple with their profession, doctors, a consultant that they have, together with the product that they have inside their businesses, and give the whole personalized package to their clients.
Great. Well, thank you so much for sharing. Unfortunately, we're going to have to take a quick break. Of course, when we come back, we want to hear more about Supagene.Asia and KLEAN. Don't go anywhere. Welcome back to The Nation, and thank you for staying here with us. First in the studio, we've got Dato BODEN, CEO of KLEAN, as well as NURA SAMSUDDIN, co-founder of Supagene.Asia. Now, earlier we were talking about some products and your target market. Supagene.Asia, tell us some of the key understanding digital transformation has been identified as one of the key priorities. Why is it important for tech companies, and what are some of the barriers for adoption?
All right. I think coming from a health and also tech company itself, I think we see the digital transformation is very important to serve mainly is to serve our market need. People traditionally going to hospital and then they have to do appointments and then they have to do all the waiting things. Waiting things is one of the problem, and another thing is during the pandemic, people are actually restricting themselves to indoor. They don't want to like go to a place that have a lot of people. So by having transforming every process into a digitalized, now at the comfort of their home, they can run everything by themselves with connecting with the professions. So in terms of our DNA testing, imagine you don't need to go and make appointment with doctor and then get the sample to run the DNA testing. With the comfort of your home, you can just open up your laptop, you can order the saliva collection kits, and then you can also pass back the sample to us. We run everything and we will provide you with the whole DNA reports. After the DNA reports, we also provide a virtual consultations based on your personalized DNA report. So imagine everything as compared to last time. Now you can do everything in the comfort of your home, and that is the help of the technology. I think that's
Yeah, definitely more convenient. I mean, no more waiting in lines, no more enduring the traffic to the hospitals and the parking. Interesting. And, tell us a little bit more about how the process works. I mean, you mentioned that they order the test kits. They do it at home by themselves. And how long does it take for the results to actually come out?
all right. So once they got the kit, they will provide us with 2 ml of their saliva sample, and then they will return back to us in our lab. Once we receive the sample, it takes around 18 working days for them to receive the sample. In terms of the timeline, we are actually the fastest in the market. So within the 18 days, they will get their reports, and then they were able to set an appointment with our consultant to do for the next consultations.
All right, very interesting. Now, for you, Dr. Nick, tell us more about KLEAN and why do you think it's so important for us to incorporate AI, such as yourself, into the product?
Well, I think everything is around data. So if you look at different, whether it's healthcare or recycling, it really boils down to data. And especially around recycling, we don't have very much accurate data in Malaysia and Southeast Asia, because we don't know how many plastic bottles are sold a year, how many of them are recovered, how many of them are recycled. So AI allows us to get really granular data in and around the type of container. If we train our engine, we are able to also tell you what brand of container that is. And that's really important for large companies like Coca-Cola, Nestle, F&N that make 100 plus. These companies make a lot of money from selling these products every single year, and they have massive plastic footprints. But what are they doing to contribute to the recovery of these containers? So there's a lot of noise now about what they call extended producer responsibility, EPR, which is essentially a form of tax on these companies, which will then be used to recover back these containers. So reverse vending and what we call container deposit schemes are not new. They're done in over 70 territories around the world. And it's the only proven way to get recycling and recovery rates for plastic containers above 80%. For example, in Germany, it's a law. When you buy a plastic bottle of water or a cool drink, there's a 20 euro cents attached to that purchase. If you put those containers back into the reverse vending machine, you get that money back. So it's a very simple concept. And they have a 98.5% recovery rate. That means almost 100% of the plastic containers that are sold in Germany are recovered. And that's a phenomenal rate. Malaysia, we're not 100% sure what those figures are because we don't have that data. But it's probably hovers around 20% of containers that are sold are actually recovered for recycling purposes. So by virtue of AI and digitizing the technologies, we're able to get really, really good granular data around, how many of these containers are recovered every year. And that allows government policy to come into place around how do we force companies and encourage companies and individuals to actually change their behavior and put these containers into systems which can recover them back and recycle them to be used again. So as part of that circular economy.
Great, interesting. No, and prior to introducing this product, has it been done anywhere else in part of the world? And what sort of behavioral changes do you see amongst Malaysians, specifically Malaysians, right? I mean, I guess we are heading towards that direction. Supermarkets have stopped, preventing the use of plastic bags, for example, and plastic straws as well. We no longer see it in McDonald's, fast food chain restaurants. So, where do you see these behavioral changes heading towards for Malaysian sector?
Well, I mean, I think the one thing that is going to be next to impossible to get rid of is our single-use plastics around. Well, they're not single-use plastics. A plastic drinking bottle, a PET bottles are actually a pretty amazing invention if you think about it. You know, half the world's population does not have access to clean drinking water. So these are important ways that people actually get water. So in times of war, in times of floods, in times of famine, or if there's a problem with water supply, how do you get your drinking water? You get them through water bottles. So this market worldwide grows at around 5 to 7% per annum. So it's not going to disappear. So it's important that we create a circular economy out of this, and that these bottles can be recovered and be reused again. So recycled PET is used in drinking containers. Unfortunately, not yet in Malaysia. That law needs to be changed, and the process of using recycled PET in our drinking containers is currently not halal certified. So every single drinking container or food grade plastic container in Malaysia is made from raw PET. We're not actually allowed to use recycled PET in food containers, and that's something that the government is actively working on, is making sure that process is certified as being halal, which is really important, so that you know that whatever is used is clean. So that's the various challenges in Malaysia, but if we can, while that process is going on, if we can make this something that captures people's imagination and gets people to recycle and changes the behavior of not just children but adults as well through this type of system, then I think we're putting Malaysia way ahead of where it would be if we didn't do this.
Yeah, Sonia, and then on the Supagene part also, I can see that the AI functional that we put in not only be translating like the whole your DNA data into the personalized data. So the difference between us and other DNA provider in the market is that we are not only stopping to tell you that whether what is your genetic tell you. The AI information that we gathered is actually to integrate what is the next thing, what is the personalized actionable item that you need to do next. For example, if your gene telling you that you are very sensitive to fats, so our system could ever tell you what kind or how many fats or what kind of food actually you have to put inside your lifestyle. So that's the whole personalized genetic information, also personalized like wellness and also healthcare that our team is already built through using the AI information technology.
Great. Interesting innovation both of you have there. But we're going to have to take another quick break, guys. Of course, when we come back, we want to hear more about Supagene.Asia and KLEAN. Don't go anywhere. All right, welcome back to The Nation. Thank you for staying with us. Of course, earlier we had two very, very interesting guests with us, Dr. Nick BODEN, the CEO of KLEAN, as well as NURA SAMSUDDIN, co-founder of Supagene.Asia. Now, we're talking about some of the benefits and of your innovation to society. Of course, the long-term behavioral change that we'll be expecting among society. Tell us a little bit more about, what are some of the areas within healthcare, NURA, do you foresee would experience the biggest impact from Supagene.Asia?
I think our one will be more on a wellness part, because we understand that wellness will cover everything. It's not only your well-being. It includes your mental health, include the way you're eating, include exercise, and includes skin also. So I think the biggest industry that will be impacted by the service that we are offering is actually the wellness. Since our report can produce a multiple portfolio report ranging from the nutrition sensitivity, the supplements, the fitness, the skincare, the risk of the carrier, the disease risk, and also the cancer risk, also the carrier. I think all this information is beneficial for this wellness industry to get into and offering back to their clients.
Great, thank you. Now, Dr. Nick, for your product, KLEAN, what are some of the perceptions of the public in terms of introducing AI? How has the acceptance rate been like so far? Understand you are actually incentivizing them, but what's the shift like for the people here in Malaysia?
Well, it's something completely new. So these machines have never existed in Malaysia. So it's really a virgin territory and experience for people. So it's a bit like using an ATM machine for the first time. There's a bit of a learning curve. So there are issues around people getting used to the process of putting a bottle in, and it reads the bottle and accepts it and goes inside. We were always worried actually that people would put dirty containers in, but we've been really pleasantly surprised by the real maturity and level of recycling knowledge that Malaysians actually have. I think we can almost accept that. I think everyone across all social economic spheres in Malaysia are aware of the environment now, and they're aware that plastic is not a great thing to have lying around and blocking up our drains, with all the floods we've had and ending up in the ocean, etc. So the awareness of Malaysians is quite high, and that's thanks to the 3R project that's been going on for the last 20 years at schools in Malaysia. But now we need to scale it up, right? Now we need to make this not just something that children do and then finish when they're at school, but it needs to be something that has some economic benefits to people. In states like New York, in Queensland and Australia, people pay part of their rental off from recycling other people's plastic containers. In Australia, someone paid for their honeymoon just by collecting aluminium cans and plastic containers and recycling them in a similar type of system. So people can actually, make a living and offset some of their costs, which is so important now in a post COVID world where a lot of people have lost jobs and inflation is hitting quite hard. So if you take 10 or 50 plastic containers, you get 5 ringgit off when you go shopping at Lotus. That's quite a significant saving just by taking plastic and putting it into a machine. So it's not difficult to convert people and to capture their imagination. We've been very excited about how Malaysians are adopting this.
Great. So it's a win-win situation for all, for the environment itself. Of course, the most alarming recent finding that we've been hearing is the microplastics that are being detected in human blood. So kudos. I think, very, very great and interesting innovation that you have there. Now, for you, Nura, understand industry players are, encouraging AI in adoption into their products. What is the public's current perception of AI in healthcare specifically? I know you mentioned, you offer convenience, but above that, what is the public's current perception about these things, having been done virtually and building that trust among the public?
Yeah, I think the best thing that our AI can solve now, from the information that we gathered from the genetic information of our client, apart from just ditch the one-size-fit-all solutions, now they can do everything personalized. They can, with this information, they can do personalized supplements, personalized nutrition, personalized skincare, personalized everything. But having to have this digitalized information inside our business also, we realize that, yes, they do like the personalized solution and information and all. But now we are talking to them like virtually consultation. We are actually seeing them. They more prefer towards talk human to humans. When we have all this virtually platform available, I think humans interaction is something that our client is still doing. The perception of our clients towards this AI is they are still accepting.
Yeah, and of course, before we go to closing, our viewers out there would love to hear more about Cyberview Living Lab Accelerator program. Maybe before we close, perhaps you can share with us how the CLLA program has helped you move up the value chain, Dr. Nick.
Yeah, it's an essential part of a startup experience. We don't know all the ins and outs of how to scale up, how to put together better pitches, those key networks, and we've just found it extremely invaluable. That we've been able to work with the Cyberview Accelerator program. It's been really great. I would encourage any startup out there in Malaysia that really wants to fast track their experience to join it. They're an amazing team, and we're so happy to have been part of it.
Yeah, they're not only mentoring during the progress, but they also like really connecting us with other big player and also making Cyberjaya as a pilot for us to do our own business over there. Yeah, so
Great. Well,
really
thank you.
encourage everyone.
Great. Well, thank you so much for the very insightful session. Of course, I wish you both all the best in the development of your products and in the future. Again, thank you so much. It's been a great pleasure seeing both of you. Now, the implementation of AI is still in its early stages in Malaysia. According to the 2020 Malaysian AI Blueprint, AI will take longer to emerge as a result of the lack of talent, money, and training. To combat this, local startups are incorporating AI into their offerings, and many startups are enabling crucial industries such as smart healthcare, particularly senior care, in speeding up the digital transformation journey. As we prepare for future outbreaks, now would be the time to ignite AI-based advancements in the healthcare industry. My name is Sonia, and thank you for joining us on Nation.